Well, good afternoon, everybody. Welcome to our webinar today on how to leave the rat race and become a healthcare entrepreneur. Now, you might have no clue as to what that's all about, depending on what research you've done so far about our business. But today, I'm going to tell you how to get out of whatever it is that you're doing now that you don't like and get into something that I think you're going to like. Healthcare is a huge industry. It's growing by the day. It's in the news every day. It's going to be huge for many, many years to come. In fact, it's about 1/5 of the entire gross domestic product of the United States. So if you're going to get into a business, why not get into one that has some growth to it? So I'm going to just introduce myself here and tell you a little bit about what's going on. Now, if you're wondering what we are actually doing as a company and you haven't done enough due diligence to know yet, we actually get you into the healthcare business by providing to you our cloud-based medical billing and electronic medical record system. And as you can see, it's really the latest thing because you can access our system from any device at any time as long as it's connected to the internet. I mean, I'm talking about your phone, any phone. It doesn't have to be an Apple phone. It can be anything. It can be an iPad or any other tablet device that's out there, any computer system, any browser. This is a true universal system, folks, that you can use to do the billing for doctors and make money. And I'm going to show you a little bit about how to do that today. Now, this is our website at absystems.com. You'll see it at the very bottom of the screen here on this slide. And if you haven't been there and somehow got to this webinar from a friend, maybe, go ahead and write that down at least and jump in there anytime you want to and look at our website. Don't forget to hit that orange button that big old arrow up at the top there is pointing to, because that is our new virtual brochure. And folks, that will take you to a completely different website that you have not seen yet. If you haven't filled out that little form that it'll ask for your name and your email address, of course, fill that out and you'll be able to browse this site, which has much more information than you'd ever see on our regular site. It also talks about our entire due diligence process. If you're wondering step by step, what do I need to do to get involved with American Business Systems? This is it right here. These 6 items that you see here on the screen is exactly the steps that you'll go through working with one of our, what we call coaches, our business coaches here at our offices in Fort Worth, Texas. So let me start with this first slide here. Now, if you've never seen this quote before, think about this just for a second. This is from the blackbookrankings.com. You can go there and they do a lot of different surveys for different industries, but for the healthcare industry, it says 89% of all physician practices agree their billing and collection systems needs upgrading. Now, why is that good news for you? Because when you get into this business, you can switch a doctor from the current software they're using to do their own billing or from the company they're using to outsource it right now to your system. You will be what's called a licensee. This is kind of like a franchise, but it's a licensing situation. So rather than restrict you with all the rules and regulations and control that a franchise has over you, we let you run your own business, name your own business, come up with your own logo. We provide a website for you as a part of our package, but you're in the medical billing business. Now, I'll show you, it's much more than that as we go through the webinar here, but think about this. If the doctors are agreeing that their billing and collection systems need upgrading, it means they know that they're not using the latest technology, which means they're probably not collecting all the money they could be collecting. Does that make sense? Yeah, and you're gonna help that doctor collect not 60 or 70% of the money that they normally collect out of what they bill, but up to 98% of that. That's right. 98%. Now, folks, that means money on the table for the doctor that they're not getting right now that you'll be able to provide for them. I think I just hit the wrong button and went forward, backwards or something there on my slides. Let me try that again. Okay. Now, here's the next quote that I want to give you. This is an interesting quote from Healthcare Finance website. And it says a new report shows more physicians that own medical practices are deciding not to sell their businesses. That's right. A lot of doctors are selling their practices. Well, more and more are deciding against that. And the reason is because they are planning some of them, the ones that are going to sell or merge or sell their practice, are citing a surge in administrative work as their top concern. See it right down here? Too much administrative work. 40% of them said that. There's profitability challenges. Look, Can't we solve the administrative thing? Yeah, we take that out of their office and let them concentrate on their core competency, which of course is helping patients get well. Profitability challenges, 35% of them said they're getting out as a practice, as a private practice because of profitability challenges. We can help solve that, folks. I just told you that we could increase their revenue by 20, 30%. Yeah. And then, of course, there's all kinds of regulatory burdens, things that the government puts on them that we can take away from them because we're using our system and we're handling all that for them. Anyway, and there's some other reasons there, of course, too. Some of them are just changing professions or retiring and so forth. This is good news for you. And look, here's a continuation of this. As the index shows that physicians continue to grapple with declining reimbursement. Now, folks, that's the business we're in, is helping doctors get every penny they can possibly collect from the money that they bill to the insurance companies. They have rising costs, of course. We can show them how to even save on that because it's going to cost them less, that's right, less to outsource to you as an outsourced biller than it would be to have somebody do it inside their own office. And it says they're also investing in new ways to shore up practice operations and boost profitability with technology playing a key role. Folks, technology changes so often that it's hard to keep up with it in today's world. Well, ABS keeps up with the technology because we have technology partners that spend literally billions of dollars a year making sure that we are on the leading edge in technology. That's why I said earlier that we have a cloud-based system, which of course is the future for all software. Anybody who's using software that comes on a CD, that they actually install inside their computer, that's old technology. And we have bypassed that and just gone straight to the cloud, which just means our software is hosted on servers that are out there in the cloud. Everybody's going that direction, and that's what we've decided to do. That way, you and the doctor's staff can access that from anywhere in the world on any device that has an internet connection. But here's some of the challenges that doctors are facing right here. It says declining reimbursement. See, again, folks, we can increase their reimbursement. In fact, when my wife and I did medical billing back in the late 80s, early 90s. And when I was out there talking to doctors, I used to say to them, Dr. Jones, I can collect for you every penny that you've earned. And they get that. Doctors can relate to that. You know why? Because doctors know. I mean, inherently inside, they have this gut feeling, and they probably lose sleep at night knowing that they're billing, let's say, $100,000 a month to the insurance companies and to Medicare, and they're only collecting about 65 or 70,000. Now, how would you like that if you were a business person? Only collecting 70% of everything that you build. We're going to show you how to bring that up to 98% or more. And so this is why, folks, there's no selling in this business. You are, unless you think of selling popsicles in the Sahara Desert, would be a hard thing to do, because this is an easy thing for doctors to see. And I'll show you why as we go through this. Okay, so there's some other things, of course, that they're dealing with there as well. One of them, notice right down here, is efficiency of the staff. We can eliminate that by reallocating the time that the staff is using now to collect from patients, to bill insurance companies. We can reallocate that time to helping the doctor's practice run more smoothly, and perhaps to even see more patients if that's what the doctor wants to do. We can even protect them from some of the recent HIPAA changes, as it says down here. They're concerned about that. Well, they should be. And we have a service, one of the services you can offer to doctors, that solves that problem as well. Okay, look at this quote now. Look, I hope you're writing all this down, taking notes. I may take a moment here, though, to actually put this in handout inside of the handout section over there. Now, I'm talking to my behind-the-scene producer, who's on here with me today. Possibly could pull up this slideshow out of our webinar folder there and actually do a PDF handout and drop that in the handouts there. But anyway, I'll do that if they don't do that for us. I'll be watching that handout section and see if it drops in there here in just a second. And then you can download all these slides. But look at this one from the American Academy of Professional Coders. Industry experts have found that the average number of rejected claims for a medical practice averages around 34%. Now let that sink in for a moment. Of all the claims that doctors send in to get paid from the insurance companies, 34% of them are stamped rejected for all kinds of reasons. But just trust me, we're going to tell you what those reasons are when you come to our live training workshop, and we're going to show you why you are going to bring that back up there. I should say bring that number down to less than 2%. Now, folks, that means that you can increase the doctor's revenue by 30% possibly. What would that mean to a doctor to have an extra $30,000 a year in revenue that they're not getting now without doing any more work? Would that be hard to sell to anybody? Well, I'm going to show you why you are not even going to get anywhere close to selling. In fact, we tell people who come through our training, if you had any background in marketing or sales, you need to forget most of that because it does not apply to this industry. All we're going to do is find out if the doctor has any pain. You know, like when you go to see the doctor, they start poking you and say, does it hurt here? Does it hurt here? Does it hurt here? We're going to do that to the doctor through a practice analysis that will tell us if they've got pain. And if they do, we're going to show them that we have the remedy. Right. Now look at this from the Medical Group Management Association. Based on a single provider office sending 6,200 claims in per year, according to MGMA, it costs an average of $27.50 to rework a denied claim. Now, do you understand why a lot of doctors' offices do not even mess with those denied claims? Because it costs them money to do that. A lot of the times it's just human error. They forget about it. It gets lost in their computer system, and they're focused on the patients that are coming in today, trying to get those claims filed. You see, so they don't pay attention to this because this is not their core competency. Even the people who were hired to do the billing, they were not taught that they should stay on top of those denied claims. And we're going to show you how our system will get all those claims through without you having to do anything. And the few that are rejected, that 2% I talked about earlier, that's an easy one to solve if it's a human error. We're going to show you how to do that. So folks, from what you've heard so far, you can see that doctors are worried, and they have a good reason to be worried because look, they got into private practice because they wanted to help patients, but if they can't pay their salaries and overhead and costs, they can't stay in practice. They have to go become an employee for somebody else or change professions completely. And that happens more than you'd realize. Even though a doctor spends $100,000 plus to go through medical school and then a couple of years of residency, some of them just change because they cannot deal with all these problems. We are salvaging the private practices in America. Our licensees are actually changing the communities that they live in by helping the doctors stay in private practice and not having to go to work for a hospital or something like that. Okay, now, the answer is, of course, that you can help. You becoming an ABS licensee and powered by American Business Systems. That means behind the scenes, we're there. You don't use our name, you'll establish your own company name. But we're going to be there behind you. We are your support staff. We have lifetime support, folks. So that means once you become an ABS licensee, we're going to continue to support you over the phone, through email, on our licensee website, our webinars that we give on a regular basis to continue training our licensees. All that's included in our license fee, and you never have to pay for any of that. So the great thing is that you are much larger than you think when you go out there in the marketplace. You can actually tell them when they ask a question about something about insurance that you're not sure of, let me check with my insurance specialist at the office. Well, when you get back to the office, guess what? Or on the way to the office, you pick up your cell phone, you call us. Our support people can answer any question that you have. And you can even do it from the doctor's office and talk to somebody in my office here that does know the answer to your questions and seem to be a much larger company than you really are. Perhaps maybe it's just you working out of your spare bedroom in your I started to say underwear. That doesn't sound good, does it? How about working out of your spare bedroom in your pajamas, right? I mean, that's the dream of a lot of people, working at home, right? We can help you do that, and yet you can seem to have many more people behind you and supporting you than just being you or you and your spouse. So folks, when I say that it's powered by ABS, your company will be powered by ABS in that we have all these other ancillary services. See, besides the iClaim system, which is the billing system itself, and the electronic medical record system that you can provide to doctors if they don't have one already, you also have all these other services that you can offer. See, AutoCard, Quick Collect, Choice Pay, Audit Guard, Code Right, iDocs Now, and Compliancy Guard. Now, folks, these services are needed services. Doctors need these services. And I'll talk about a couple of them here in just a second. Just trust me that they need every one of these services, probably. But as an ABS licensee, you don't have to offer any of these if you don't want to. We just came up with them throughout the years, in our 25-year history. We've come up with these services because our licensees would come to us and from time to time say, hey, look, I have a doctor that's having problem collecting money from their patients. Do we have any way of doing that besides me having to send out letters or pick up the phone? So we developed a system called Quick Collect. There it is right there. And that one service alone can rev up their revenue from their patients. Most doctors don't collect but about half of all the money that they bill to the patients. And so we can help them collect, again, up to 95% of that. These are all services, folks, that are provided through ABS for our licensees as extra services that you can offer to the doctors. And yes, you make money on all of these. By the way, I'm going to throw this in because I fail to mention this every once in a while on a webinar, and I don't want anybody to ever think that we're hiding anything from anybody on these webinars. We, the company, and by the way, I'm the CEO of the company, if you're wondering. I didn't introduce myself properly earlier, but I am the CEO of the company, and I can tell you that we make money on all these services. All of the partners that we've partnered with, technology partners, for example, that power some of these services, all give us as a company rebate checks on a regular basis based on these services. Now, you don't pay anything to ABS. We're getting that from our technology partners. And they're still being able to charge you for these services much less than you could ever find something out there on your own, because we've negotiated. We've got lots and lots of customers to bring to the table. So these technology partners work with us. I'm just telling you that so you know that this is why we can offer lifetime support. You never have to pay any more membership fees, training fees, extra user seats for the software, upgrades to the software, no fees. None whatsoever. You'll never pay ABS another fee because we're taken care of by our partners. And by the way, folks, that's an important point too. You are part of the nation's largest network of medical billers that are out there. Now, I said earlier, it's much larger than just medical billing. You can see that from the services I just talked about. But we actually certify you when you go through our live training workshop as a certified medical revenue manager. Now, the reason we call you that and give you that title and that certification is because you're going to be managing the revenue from all aspects of the doctor's practice, from the insurance companies, from Medicare, Medicaid, from the patients. Any money that's coming in, you are managing that for the doctor. And therefore, you're going to be able to charge a percentage to the doctor for all the money that's brought in each month into that practice. So isn't that a motivation for you to bring in as much as you can for the doctor? Absolutely. And by the way, the other licensees that are out there in America that have signed up with ABS, they're not your competition, by the way. They're your network of support. That's right. All of these people that you see pictured right here, for example, are what we refer to as our licensee coaches. Yes, they can coach you. Now, you're not paying anything for that. That's a part of what we supply to our licensees. We are actually compensating these licensees for their time, as we should, right? Because they're donating their time when we ask them to help another licensee for you, and they need to be compensated for that. So ABS takes care of all that. But here's what I'm saying, guys. You're not alone. Could you start your own medical billing business? Yes, my wife and I did. Now, that was 25 years ago, but you could do it if you had the time and the know-how and the connections to put all this together. You could develop your own marketing materials, which we spent over $100,000 doing that. You could do your own demos of the software, the technology to show the doctor. We do that for you. And again, there's no extra charges for any of this. So having these people on board is a good thing. You can't ask one question about anything to do with the revenue cycle in a doctor's office, that we don't have experts ready to answer those questions for you. You also will blow out the competition. Why? Because we have the medical technology. And by that, folks, I mean we have the latest technology. When doctors see the demo that we do of our system for you, for your potential clients, they are blown away. They have some of them will literally say, we'll hear them on the phone call, wow. Or they'll be talking to their office manager saying, did you know that could be done electronically like this? I mean, it is the most fantastic thing. In fact, it's so important, these demos, that we do those for our licensees. There's no limits. You literally have a site that you go and sign up and give us the suggested dates and times that the doctor would be available. They need about 45 minutes to see this. And folks, we have doctors get on there knowing that they're going to be on there for 45 minutes, and then they're on there for an hour and a half. You know why? Because they love to see the latest in technology, and they don't have it. iClaim is a very unique product, and so is EMRX, our electronic medical record system. Excuse me. Now you see that illustration there of the doctor holding the iPad. This is what's great about this, guys. Look, I went to a doctor a little while back, and when he walked in the room, he had a laptop with him, right? He's bringing in his laptop. And what he does is he turns, he doesn't even, we never make eye contact even. He just sets down his laptop behind him there and turns around and starts asking me questions and typing stuff in. Very impersonal. So this solves that problem. Sorry, had to mute myself there to cough and take a drink of water. Okay, well anyway, as you can see, I'm excited about the technology. You should be excited too, because when we do these demos for your doctor, in about half the cases, about 50% of them will move forward with you immediately to become involved with us. Now, not all of them move forward, but that's a pretty good ratio of doctors who go, yeah, I think I like what I see, give me a proposal and let's move forward. So if you haven't seen a demonstration yourself, one-on-one with one of our business coaches, the person who sent you the email to this webinar can arrange for one of our demonstrators to get online and show this to you and answer all your questions about it. Ask for it. You'll see. Now, let me tell you what the advantage is. People ask us all the time, well, why are you so different from all the other medical billing companies out there? Why would I have an advantage in my marketplace? Folks, it's because we've put all the pieces together. Look at this diagram here. We have a practice management system with a built-in scheduling system. It verifies the eligibility of the patients in real time with the insurance companies. You can give access to our system, you see, to the doctor and to their staff with a password and an ID and so forth. You can give them access to it and they can see what you want them to see. Now, they can't do the billing, of course, because that's what you're there for, but they can use the scheduler and see everything else about the status of their claims inside of it. Along with it, I mentioned earlier, we have the electronic medical record system. Now, some doctors have their own EMR already that they're using, sometimes referred to as an EHR, electronic health records, and they're using that already. That's okay. We can actually work with this EMR that they're currently using. Now, eventually, what happens is, as you tell them some of the things that EMRX will do, they'll want to move over to it. Because, folks, once you get inside that office and become an inner part of their team, doing their billing, you can show them the EMRX at some point down the line, and they will switch over to that probably. Then here's a very unique part too. We have a clearinghouse. Now, every medical billing company out there and every doctor has to send their claims to what's called a clearinghouse. This is a third-party company that's set up to receive all the data and then reformat it and forward it to the insurance companies. They also do some scrubbing, making sure that everything is filled in like it should be. We don't have to go through a third party. If you become a licensee for ABS, don't have to deal with clearinghouses. You know why? Because our clearinghouse is an integral part of our system. Our system was designed over 20 years ago by two doctors. They started doing the clearinghouse function for other doctors and then laid our software right on top of that so that it's totally integrated. We are the one who basically, when you send the claim, it comes directly to iClaim, and then we forward that on straight to the insurance company. We don't go through a clearinghouse at all. That's why our rejection rate, listen, that's why our rejection rate is less than 2%. That's the only reason, because we have our own clearinghouse. You work with any other clearinghouse, you're going to see the rejection rate can be tremendous. Then one last little piece in the bottom right-hand corner here, the patient portal. I have to talk about this because even though you may have used your patient portal with your current doctor, you haven't seen one like this. This one is the leading technology. It keeps everything about every visit. All the medications are in there. You can even set up your own appointments through this, and you can even have what's called an e-visit with the doctor. Yeah, sometimes they're referred to as telemedicine. Folks, this is the future. They'll be sitting and talking to you just like I am right here on this video, except you can turn on your video too. If you need to show them, here's a mole or a boil I'm worried about, you can show it to them on the webcam and have a visit with your doctor. That's right, that's the future. And we have it already built into our system. It's not a third party, it's not a plug-in, none of this is, folks. This is all written by the same programmers sitting in the same room where we throw them some pizza and Pepsi every once in a while. I'm just kidding about that. We treat them much better than that. But the point is, we don't have to piece this all together and hope that it works with other. Look, there's another company out there that does something similar to what ABS does, and that's what they do. They've pieced together all sorts of different pieces to try to make them work together. You even have to install some of their software on the doctor's hard drive in their computer in their office and make sure it's updated constantly. Then you have to have another piece of software that connects it to your computer so you can communicate with the doctor's office. With ours, I literally can take my cell phone right here, right now, and connect to our system and see anything that I would normally see. Now, it'd be kind of tiny on a phone. That's why we built it really for the iPad or for a tablet, because that's the right size for that to actually be, held in the hand. And when they're seeing a patient, for example, they can just hold this iPad right here in front of them and ask some questions and tab. What a difference between that and what my doctor did the other day to turn away from me and sit at a desk. This is the greatest thing since sliced bread, and doctors all agree about that. Okay, now let's talk about the three things here that we can offer to you in becoming a healthcare entrepreneur. First of all, I want to talk about the needs of the doctors. I want to talk about the solutions that we have for those needs and the value that we're actually offering to the doctor. Because look, I'll be willing to buy anything from you if you show me that the value is there. Now, sometimes I spend money on stuff that I don't even know what the value is, but I like it and I want it, right? But many, many times businessmen like doctors will make decisions based on the value. So I'm going to show you why we can bring the value to the doctor. Now, first of all, we help you find the doctor's needs. It's real simple, folks. We're going to teach you to market to a doctor. Because look, let's face it, isn't that the hardest part of any business? Really, no matter what you're looking at on the internet, as far as business opportunities, franchises, and so forth, no matter how fun it sounds to do the actual business itself, guess what? You don't have a business if you don't have clients. And so we're going to help you find and know how to approach doctors so that they want to give you all of their pain. That's right, they have pain. Sometimes they don't know that until we ask them some questions, but that's why we do what's called a practice analysis questionnaire with the doctor. Now, folks, over the last 25 years of being in this business, we've tweaked and honed this down to exactly the questions that you need to ask a doctor. We'll show you how to get in to the doctor, and sometimes you're doing this with the office manager. Sometimes the doctor doesn't even know the answers to most of these questions. But in any case, we'll show you how to get in to do this questionnaire. Once you've asked these questions, I think it's just showing 2 pages here on this slide, yeah, but it's actually 3 pages now. When you ask these questions, you basically close your notebook and say, okay, thanks for your time. I'll get back with you. Yeah, see, I told you there's no selling to do here. There's nothing you have to sell until you go back and analyze this. And once you've analyzed this and created a report that you can bring back to the doctor, showing him the exact savings and increased revenue that you're going to bring to him or her, it's a done deal at that point. Now, somewhere in there is that live demo too, so don't forget that that's a part of what we do for you. We do the demo, we answer all the questions the doctor asks, and all you do is just get ready to write up the paperwork. excuse me, by the way, this practice analysis, this one, somebody had it on their iPad or something, was filling it out, as you can see, typing in some answers. But they give you all that they need right here in these questionnaires. And you're simply filling it out. Then you go back to the office and fill out our practice report, our revenue report that shows the doctor how much you can save them. Oh, there's a picture of the 3 pages. I guess we just added that in to show you. Okay, now let me show you how we provide the doctor's solutions. I showed you earlier that we have the complete package that a doctor needs. That is, if they're going to do electronic medical records and they want the billing tied in with that so that the EMR is sending the right codes over to the billing section, the practice management system, we have that. We show them the advantages of not having to deal with a clearinghouse, and every time we bring that up, the doctors and office managers go, whew, we are so sick of trying to get information out of the clearinghouse as to, where did the claim go? Did you get it? Why haven't you paid it? What's wrong with it? All of that is solved with our built-in clearinghouse. And we give them access to a patient portal that's unlike anything they've ever seen, and they're just as impressed with that as they are at the system itself. Now, our solution for the doctor also includes all of the different services that I showed you earlier in that illustration with the stacked boxes. This includes, of course, iClaim and EMRX. Now, those are the only things really that some licensees focus on. I'll be honest with you, some licensees don't even offer any of those other services that I just told you about because maybe they've got some connections in the medical field. They get their first client, that client gives them referrals, and they're just off and running. They don't need to use the other services. It's a great thing to add into your proposal when you bring it back, because if the doctor likes it, there's some extra money for you. If they don't like it, you just eliminate that. So it's nice to have those other things. Now, the iClaim value is there, folks, for several reasons. One of them is that the claims are paid faster. Do you know that the average doctor doesn't get paid on a claim for 30, 60, sometimes 90 days or more? Yeah, we hear that from licensees all the time when they ask that practice analysis question about that, how fast do they get paid? Now get this, our average is about 14 days. However, we've seen doctors who are set up electronically to receive the money directly into their bank account through an ACH transfer. We've seen them get their money in as little as 5 days. That's right. We can bill for that on Monday, and the doctor has the money in the bank account, his bank account, on Friday. Now, that's not the norm. I'm telling you, 14 days is the norm, but that's a whole lot faster than they're getting it now. We also give them real-time access to everything. Now, let me tell you how important that is. A lot of doctors see patients who are not eligible for that visit. In other words, the insurance company would not pay for it. They don't find that out, many doctors, until after the visit. We can check on that eligibility through our real-time access to those insurance companies. And since we're cloud-based, we can push a button, and the staff at the office can push a button and find out, as long as they have the insurance, member number for that patient, they can find out whether they're eligible to be paid on that visit while they're standing there, or even before they show up in the office. And folks, that increases a doctor's revenue right there, because they're not spending time. Because how many patients do you think that think they're going to be covered by insurance, and then they go to the doctor, and then they get a bill from the doctor and says, oops, your insurance didn't pay for it? How many of them pay for that? Well, this is why doctors, I told you earlier, don't collect but half of all the money that they pay. Because some patients just go, oh, well, I thought that was covered. Deal with the insurance company. I'm not going to pay that. And then they go see another doctor, I guess. Okay, we also give you real-time analytics. Now, that's important to know, because how would you know if your rejection rate is less than 2% or not? Well, it's because we have real-time access to it and real-time analytics. You will see a pie chart pop up, and we'll show you that immediately right there on the screen. And giving the doctor access to our system, they too can have immediate access to all of that. Now, I don't see any questions coming in the question box, and we're about halfway through the webinar. So if you have a question that's up there about our business or anything I've said today, type it in there. I'll see it. It's right here on my screen, and I'll just address those as they come in. Now, if it's a question that has real specifically something to do with you and your financing of the business or something like that, you need to go back to the person who sent you the email to get you here to this webinar. Your business coach here at ABS can guide you through a lot of things. But in general, if you think it's something that everybody should know about, just ask the question. I'll be addressing them here. Can somebody type something in there that just says, we're still here and we're listening to you? Oh, okay. Well, here's Fitz. Is already asking a great question. Thank you, Fitz. All right, I'm going to address this right now. Can iClaim connect with other electronic health records? Now, it's a great question. I just want to clear up one thing. The iClaim that you're looking at right here is the practice management system, they call it, or the billing system. This is what actually does the billing. You are doing the billing using our system behind the scenes for the doctor, okay? But they have access to it because they can get to the scheduler and they want to see the status of the claims, and all the patient demographics is in here and so forth. The EHR is something different, but to answer your question, yes, we can pull in the information from other electronic health records into our system and work with it. This is why I said earlier, Fritz, that you can continue working with whatever the doctor has when you first meet them, as long as they let you do the billing, and then somewhere down the line, some of them will move over to the EMRX. Now, one last point here, and I'll move on here. Web-based, this is a web-based system, folks. Now, let that sink in for a moment, because that scares some people, I know. Where's the data? How private is it? Is it protected under the HIPAA rules and regulations for patient privacy? The answer to all of that is yes. We are HIPAA compliant, and that means that the government has looked at our system and said, yes, we agree that you conform to the rules and regulations of HIPAA. Being web-based means that you can access it anytime, 24/7, 365. Any day, anytime, you'll be able to access the system. Our system has only been down like 0.1% of the entire year. And that goes down because we choose to take it down to maybe make some upgrades right quick. It's usually at like, 3 a.m. in the morning. But we let people know ahead of time, you have until this time to log off, and then we're going to do some upgrades until this time. And it's on multiple servers. We call them redundant servers. Now, that just means that the data that you put in goes straight to our server in one part of the country, but it's immediately duplicated within seconds. I mean, literally, you probably don't even know that it's happening, but it's being duplicated on another server in a different electrical grid in the United States. And all of those servers are backed up nightly off-site. So the point is, web-based, cloud-based, it's a safe way to do it. We can also lower their claims rejection. I mentioned that earlier, folks. That's a big, big deal because they all are dealing with that. Now, here's the EMRX, and it has a lot of advantages to it as well. Fitz, I hope I answered that question for you. Okay, I see some more coming in here from Sandra, Anthony, Ron, and Guy. I'll get to each one of these. The EMRX gives the doctor value because, first of all, it's easily customizable. Yes, for particular specialties. Remember, you can bill for any doctor that's out there. Any medical doctor you can do the billing for, and some of them, of course, are cardiologists, and some are, psychologists, and there's all kinds, right? We can customize this for them. It's totally integrated, of course, with our iClaim system. So literally, now we're showing this here. This image right here is looks like a desktop computer, but normally the doctor is using it on an iPad or a tablet. Okay. And that's why some of the buttons that you see here, some of the choices are big, bold, easy to touch with, an adult finger, right? On an iPad. That's why those are big buttons there, we call them. And when you touch one of those, that data that the doctor puts into this system when they're seeing the patient immediately is available to you and the rest of the staff behind the scenes in the iClaim billing system as well, because it's totally, again, written by the same programmers, stored on the same servers, etc. We can simplify the workflows for the doctor. You'd be amazed at what doctors can do with this system that takes them right on through the whole encounter with a patient. Much, much faster, saves them lots of time than they're normally doing right now. And of course, there's no super bills, no paper super bills, to try to transmit to somebody. If they're doing it right now, normally, and gosh, I still get these. I have one here somewhere from a doctor recently. That's a piece of paper that, they circle these different things that they found wrong with you, the diagnostic codes they call them, and then there's other codes that they circle that the things that they did to help you get well. That's usually on a piece of paper still in most doctors' offices. How do they get that to their current biller? Well, if it's in the office, they do their own billing. Of course, it's just handed to them. But if they're doing it off-site through an off-site biller, they probably got to fax it to them, right? Now, you could have that done if that's what the doctor's doing right now, but eventually you'll want to move them to this, and then it's totally electronic. Folks, the doctors just love that. They eat that up. Okay, so here is a question from Anthony. How much is the initial cost for a doctor to sign up for iClaim service? Well, that's not an easy question to answer, Anthony, because every doctor is going to be choosing different things. Some of them will want to do just the billing and have you do the billing, and some of them will want you to provide the electronic medical record system, EMRX, so they can access that. Those would be different costs. All right, and since you're your own business owner, ABS has nothing to say to you about what you can or can't charge the doctor. In many cases, our licensees will charge what's called a setup fee. In other words, the implementation of this whole process is going to take them some time, along with our implementation experts. And so you'll charge a setup fee to cover that as well. That could be anywhere from $500 to, well, I've seen $5,000, depending on how many doctors or providers are actually in that office. And depending on how many of those ancillary services that they signed up for, as well as the EMRX and the iClaim, that could be extra costs there as well. But Anthony, let me just say this. It sounds like I'm being evasive here, but I can't give you an exact figure. But I will say this. Our website kind of clarifies this in that it goes into all of the different fees for the different services and lets you know what your cost is, your wholesale cost basically on that is. And our licensees, of course, always mark that up to the doctor. So the doctor is actually paying all the fees, but it is going to cost them something to get started. Now, I have had licensees say that they got a doctor started and didn't charge them anything. They ate the costs of getting going. For example, to sign them up on just the electronic billing might cost them, $250, $300 total. That's sometimes not passed on to the doctor because the licensee thinks, okay, I'll eat that because I want their billing because he's doing, $50,000 a month in billing and I'm going to charge him 7% of that. And, that mounts up pretty fast, right? That's $3,500 a month. So they just kind of write off that $250 or $300. Anyway, I hope that answered, Anthony, that question. Let's see. Okay, let's see if there's one more. Yeah, access from anywhere. That's important that you know that the doctor can get access to this from the golf course. That's right, from the country club. Anywhere the doctor's on a cruise, the doctor can access our system and see the status of their money. They love that part of it. Okay, Sandra is asking, what is the name of the similar company that you mentioned earlier? Claim Tech. Sandra, that's a company out in California. They've been in business about as long as we have. The only difference is that they develop their own software and it's still server based. That means it comes on a CD in a case. You stick it in your computer, that coffee cup holder that slides out on your computer. You put this in and you shove that in and install it. Now, think of this. Having that data, all that patient information on your hard drive, think of the liability that's there. This is why we moved to a cloud-based system many, many years ago. This company, ClaimTech, is still on a server-based system. They think there's some advantages to that. There are many, many disadvantages, including your liability if that computer gets stolen, if you don't back it up nightly and it crashes, you've lost all the data, all kinds of reasons why you shouldn't have the data resting on your computer. But anyway, I thought I'd just throw that in because, hey, there's somebody out there doing something similar. Now, let's see. Ron says, what makes your system be able to provide claims faster? And does it improve the rejection rate? Well, yes. I mentioned earlier, Ron, that one of the reasons that we can provide the claims faster is because the clearinghouse is built in. We're not sending it to a third party who then has to scrub it, reformat the data, and then forward it on to the insurance company or to Medicare. See, we're doing all that when you send that claim to us. And so that cuts down sometimes 24, 48 hours. So there's 1 or 2 days right there that we're saving. Then because of our built-in clearinghouse, our rejection rate is less than 2%. And that means that the doctor's going to get more money into the practice, and the rejection rate will be lowered because we're not dealing with a third party. The buck stops here. Okay, let me go to another slide here. I do see some other questions from Guy, Stephen, Ron, Fitz, and Sandra. So I'm going to get to all those, but let's move through choice pay now. Choice pay is a way of helping the patient reduce the bad debt that the doctor has with patients. Why? Because he can get paid faster, reduce the costs for dealing with those bad debts. It increases the patient satisfaction because the way we do it, all totally automated and electronic, no phone calls. And folks, it is a wonderful, wonderful way for the patients to be in control of how they want to pay the doctor. As long as they're paying the doctors don't care if they pay it out or in payments. They want their money eventually, and 100% of it, not 50% of it. And so that's what this one does for you. It increases the cash flow, it reduces the patient debt, increases the patient satisfaction, as I said, and you never send patients to a collection agency. Boy, that's the best way in the world to ruin a medical practice, because the word gets around, right? Word of mouth. The patient payment portal is where they go and set all this up with choice pay. Quick Collect. Again, we're not going to send our patients to a collection agency. What we're going to do is increase the patient retention by using this system that automates that collection process. It's twice as effective in the average recovery of funds as the doctor's office staff doing this themselves, because it's an automated web-based system. There's detailed reporting, it keeps up track with everything, and the doctors absolutely love this Quick Collect system. Again, built into our system, our iClaim system. Okay, let's see. Okay, now this is just all the different services. I'm gonna leave that up there while I answer some more questions. Okay, here's Guy from Salt Lake City. What is the average fee charged to a doctor to sign up for the services? I think I answered that earlier from Anthony's question, but Guy, I gave you a hint a while ago that doctors could be paying $1,000, $1,500, including all the setup fees, depending on how many of these services here are included in the proposal to the doctor. But it could be as little as, let's say $500, because that would cover your cost, a licensee's cost of getting them set up in iClaim. So anyway, that just depends on the doctor and how many providers there are in that particular practice. Let's see. Stephen says, when I go to the doctor's office and see the receptionist when I check in, who is she talking to in order to verify insurance? A clearinghouse or the individual insurance company? She is talking to an individual insurance company, Stephen. That's what she's having to do, is literally take the information she got from your insurance card. Remember, they always ask for that when you walk in. And they look on there and get the phone number, the 800 number, and they call up that insurance company. I have had staff members in in a medical practice say that they literally were on the phone sometimes 45 minutes before they got somebody to actually answer their question from the insurance company. On average, it's about 20 minutes per verification call. Add those 20 minutes up for hundreds of patients over a year's time, and you spend a lot of money just trying to get answers and make sure that the patient is verified, huh? All right. Ron is saying, what controls are in place to ensure Medicare, Medicaid fraud is prevented? Well, I'm glad you asked about that, because we do have a couple of things here that can help with that. One of them is our code write that you see up here in the upper right corner of the screen, the slide here. Code write will improve the reimbursement rate up to 30% because we're helping the doctor use the codes that they should be using. Now, let me give an example. A visit in a doctor's office can be one of 5 different levels, depending on how much time and what they do for the patient during that time. So the doctor may be billing on a level 1 to be safe. And I say that because if Medicare comes in and audits the doctor, they can be fined up to $10,000 per infraction for having used the wrong code. and not just the too high a code, but a too low a code as well. Maybe that doctor should have, based on what he did for that patient, be billing at a level 3, for example. That level 3 would not only get the doctor more money, but it would be more accurate for what was done for that particular patient. Then we have the next service you see right to the left of that, Audit Guard. Now, Audit Guard is a service that allows you to go in and offer this service. Remember, we have people who do this for you and provide you a report on how closely the office is following all the rules and regulations for Medicare fraud. And it also has an online system that allows the practice to stay up to date with all that as well. And so that's what we have in place to protect from the Medicare fraud. Remember, most doctors are caught because they're billing for things that they didn't sell, especially durable medical equipment companies. You know, they're saying that they rented out a hospital bed and they didn't, you know, but they're billing anyway. That's where some of that comes from, but it also comes from overbilling, overcoding, I should call it. And so that's what these services protect from. Okay, Fitz says, how can I convince a doctor who already has an EHR with an incorporated billing feature to get the iClaim EMR X combo? What's the key selling point? Well, actually, there's no one point that you'd be talking to them about, but if they've already got their billing system already incorporated, their electronic health records and all that fits, that's one of those things that is an educational process. Now, one of the things we haven't talked about today is how we help you get clients, but that's not what this webinar is all about. We do have about 10 different ways we teach to market to doctors, and one of them is to show them the advantages of having a system that's cloud-based. And remember, you're not just selling them software. You're not. You're actually selling them a service, the ability to turn over their billing to somebody else. Remember, it said earlier it cost them $27.50 to just refile a denied claim. That doesn't count the initial cost that it took, which is around $20. So they got $47 in there to resubmit a claim. Actually, we can cut that out because you're only going to charge them 6 to 7%. I'll cover that here in just a second. And you'll see that it's much easier to get them to switch over to us once they have been educated. We just have to educate them. And one of the things we do with that is a book that I wrote with a Dr. Vicki Rackner that's on how doctors can stay in private practice and thrive. And I think my Siri over here is hearing me. I said something, I guess, that sounded like she needed to wake up. Okay. Fitz says, will this presentation be available offline? Yes, it certainly will. And I don't see that handout over there in the handouts. So I'm going to put that over there so that you can grab that. It'll also be, it's being recorded, Fitz, and it'll be available. We'll send you an email and give you the link to that recording as well. Okay, let me go on from here, folks, just so we can kind of we just got 4 minutes left here. Oh my goodness. Okay, so how do we build value with the doctors? It's real simple, folks. Like Warren Buffett said, price is what you pay, but value is what you get. Well, we just happen to have it all together. The billing system, the EMR system, the clearinghouse, and our people behind everything that we do is all one of the reasons why it's a complete system that includes iClaim, EMRX, and of course our HIPAA compliant system as well. So when we give this type of presentation to a doctor, we're showing him the advantages of having other people do his billing, not utilizing his own staff. It'll save him money, a lot of money, and it will increase his revenue as well. Okay, so Dominic says, how does ABS compete with larger billing services such as ECW, McKesson, et cetera? What makes a physician choose ABS over these larger competitors? Well, it's real simple, Dominic. It's because they are large, that doctors don't like to deal with those big companies. Now, it's not that you don't have some competition out there, if that's what you're wondering about, but believe me, our licensees have signed up many, many doctors who are on McKesson or some of the other big billing companies out there. And they switched over to us because they did not like the fact that every time they called an 800 number, they got a different person. And sometimes they couldn't even communicate with that person because maybe they were located overseas. And there's nothing wrong with that other than the fact that doctors are just like you. They want to deal with people one-on-one. They want to deal with the owner of the company. And so they like the fact that our independent licensees own their own business and are right there in their city. If something goes wrong, you can be at the doctor's office within a half hour, right? And help that office solve that problem. Not that you have to do that, but in the doctor's mind, it's nice to think that if they call you over to their office, you're going to come, right? So that's one of the reasons. Okay, and then it says here, another one. Stanley says, if a doctor joins with ABS services, who installs the software? Or do we simply provide a link via email? Yes, there's nothing to install. I mean, this is hard for people to wrap their brains around because if they've talked to Claim Tech or some other company that has server-based software, they know that somebody has to put that on the computer. They have to configure it, make sure that it's continually updated. Folks, with a cloud-based system, you're right, Stanley, all you do is give a particular website address, a link that the doctor can log into. We usually put a shortcut, somewhere on their desktop that they just click on that and boom, they're there. Then they have to log in with their ID and their password and so forth. And that's all you have to do. There is no installation. Now, the setup of the iClaim system for that particular doctor's office is done by our implementation people. Remember, you're joining a nationwide network that has staff that's a part of your staff. So, hope that answered that question. Well, folks, it doesn't become real, of course, until you've actually got a contract signed like this one here and a check from the doctor. In this case, the doctor did pay $7,395 to get set up. Again, I don't know what was all included in that, but as you can see, there are doctors who pay that easily when they see the advantages we have. And hey, if you can bring the doctor another $30,000 a year or more in their revenue, why would they object to paying a few $1,000s there to get set up, right? Okay, let's talk about this just for a quick second, then we're finished because it's the hour's up. What does the average person make? If the doctor sees 25 patients a day, that's pretty simple. And if they're collecting, now not just billing, but collecting an average of $100, then they're collecting about $2,500 a day. It takes that to run, a medical office. That times about 20 billing days in a month, not counting the weekends, is about a $50,000 a month in expected revenue. All right. $50,000 a month, if you're charging the doctor even as little as 6%, and some licensees charge 7, 8%, then your average earning for you as the medical revenue manager is going to be about $3,000 a month from this particular doctor. Simple math, right? Now we're rounding all this out so it's easy to grasp in your head, but if you're wondering, if you need to make $3,000 a month, then you need one doctor. And by the way, one doctor would take you less than 90 minutes a day to be able to handle their business. So there's a good profit margin in this as well, folks. You can also plug in some numbers yourself on our website. You see the website here that we're at, absystems.com. Just go to the income potential up here and click on the medical billing income calculator. And I don't know why that went away. I was not supposed to click on that. Okay, here we go. There we go. It would take you to this page here, which lets you fill in some numbers similar to what we just showed you on the screen. And when you get through, it'll tell you exactly how much money that you could make each year servicing that doctor. So go check that out.